A good evening and welcome to the Fact Checker. My name is Raymond Mujini, and of course, every Monday and Wednesday we look at the facts that are out there and try and check them with the numbers that we have and official sources to try and give us a context of what is happening in the news. And of course, the story that we want to discuss today is a rather sad story of the COVID-19 surge in the country. Now, before we got on air, the Ministry of Health confirmed that over 1,000 people had tested positive for COVID-19, and that's where we want to start. Of course, if we could show you the graphics there. Now, on the 3rd of December, 286 cases of COVID-19 were confirmed. On the 4th of December, 290 cases were found. On the 5th of December, 311 cases were found. On the 6th of December, 701 cases were found. And on the 7th of December, 660 cases were found. And of course, today, just a few minutes ago, the Minister of Health confirmed over 1,000 cases. Now, what does that mean? It also means that the number of active cases in the country right now is 12,781, which will be revised upwards because of the confirmation we've gotten from the Ministry of Health. But if you put this into context, what does it mean? It means that from the last 5 days, the cases that we've gotten in just those last 5 days account now for 17.5% of the total active COVID-19 cases in the country. We plotted this against a timeline and tried to find out what would this mean. It took Uganda it took Uganda 6 months to get to 2,000 cases of COVID-19 from the first patient, who is called the patient zero. But in the last 5 days alone, we've been able to get what we got in 6 months. The question is, what's happening with the COVID-19 response? And of course, to answer that, I have with me in studio Emma Inebiona, who speaks for the Minister of Health. I must add that we've dragged you out of Moyo. Thank you so much for joining us. You've come all the way from Moyo to here. But Emma, we want to start with what is happening at the heart of managing COVID-19 in the country.
Thank you very much. The Ministry of Health remains focused. And the numbers you're seeing, as a ministry, we started seeing them since September. There was an increase in the number of new infections, and this was largely to do with non-compliance to the COVID-19 preventive measures that were instituted by the Ministry of Health, and also the political activities which pushed the numbers. But largely, people not wearing their masks properly, people doing away with hand washing, and also failure to maintain a physical or social distance.
In terms of the war room where COVID-19 is being fought, yes, what are you seeing with these new infections? What can you tell us with what you're seeing with these new infections?
Of course, the rise in number is somehow worrying, and that's why our appeal to whoever is watching us right now is to ensure that they strictly adhere to the preventive measures, such that when the vaccine arrives, they are able to benefit from the vaccine. So, and also because the number of new infections is on the rise, and basically it is based on alerts, people who are taking themselves for testing when they have already signs and symptoms. We shall get at a time when the healthcare system is overwhelmed, where the quality of care will reduce because the numbers will outstretch the workforce. So it's better, it is within each and every individual's means to protect themselves by adhering, because even infections are happening within families. People are now having full-scale weddings, and at a wedding there is no one putting on a mask. In public transport, in markets, on rallies. So these numbers are not surprising. It is what we have seen since September.
Emma, we were looking at the number of beds available at regional referral hospitals and juxtaposing that against the active cases, and we realized the active cases could be swallowing up now almost 40% of the active bed capacity in regional referral hospitals. Would you rightly say that the Ministry of Health now has been overwhelmed by these numbers, and that the bed capacity of the country is being overwhelmed by COVID-19 cases?
I can't say that. The bed capacity is still available, because when I look at the case management report, the daily case management report, right now we have about 485 patients admitted in the various COVID treatment units. Of these, they are the severe cases, who are about 136, those on oxygen. Then about 11 are critically ill in intensive care, being supported with ventilation, which means that they are largely depending on the machines to enable them breathe. So the other number are people who are under home-based care. So our appeal is that whenever you feel unwell, come out, reach out to a health worker, get tested as quickly as possible, because the challenge will be on the availability of the high dependency beds and also the ICU beds.
Emma, I wanted us to talk about contact tracing. At the start of the pandemic, the Ministry of Health was actively contact tracing every case. They trace the number of contacts that they had and bring them in. Is contact tracing still happening? And if it isn't happening, what is being done with regards to finding people who are contacts of active cases?
The surveillance teams are doing a wonderful job, and they remain to focus to doing contact tracing. But when we're at stage 4, where there is widespread community transmission, there are those cases you will not be able to find the epilink to know whether personally where I got the infection. So it becomes a challenge for contact tracing. But where a case is known, the teams are able to ensure that they list all the contacts and follow them up, and also ensure that the members of the family who are contacts to the confirmed case are followed up until when they have completed their days of follow-up.
Talk to us about the testing kits and their availability across regional referral hospitals. Are they enough? Are they available? Or people need to take extra caution and care now?
As you see, the numbers have largely increased because of the increase in the number of tests done. The results we have just released are out of about 8,000 samples tested. We have testing kits, but we obtain these kits on a competitive global market. So my advice is keep yourself safe from getting COVID, because you might find even when at times the test kits might not be there to have you tested. So it's better we follow the preventive measures. Let's wear our masks properly. Let's report as soon as possible, as soon as we start feeling the signs and symptoms, and do not mistake the symptoms to be common flu, because that's where a number of people have been fast delaying in their homes, thinking it's common flu symptoms, and eventually you find when you have deteriorated very fast.
Emma, this week we understood that the Ministry of Health actually filed for the vaccine, the available COVAX vaccine under the Gavi. Can you confirm that? How many vaccines is the country applying for, and how many will they be able to get?
Thank you very much. It is indeed true that our immunization program and also all our partners have been involved in a series of meetings preparing an application to obtain the Gavi AMC COVAX facility to obtain vaccines. And our application submitted on the 7th will cover about 20% of the population. And these were resources pulled by developing countries to support the countries that normally contribute to Gavi. So we are now awaiting a response, and we hope that the available vaccines, the 20% that are going to be available in the first, because the application is being done in 2 phases. For the 20% which we are going to obtain largely free, and this is going to cover health workers, the elderly, and those ones with comorbidities, so the vulnerable. So the rest of the population, there are a series of meetings also to make sure that we conclude the other application where we would like, I will be required to make some co-financing.
Thank you so much, Emma. But before you go, if you could just repeat the SOPs for people who are watching. What are those SOPs that the Ministry of Health has put in place to stop against the spread of COVID-19?
First and foremost, it is personal responsibility now, where we have reached, to ensure that you wash your hands with water and soap, you wear your mask properly, not on the chin, not in the pocket, as I've been observing, ensuring that you maintain a social distance, and in an event you feel unwell with symptoms that are consistent with COVID, that is hardness in breath, chest pains, flu, cough, the thing you need to do is to reach out to the Ministry of Health through the toll-free number that is readily on with people to receive it, and also to ensure that you get tested. That we shall be able to safeguard our lives as we wait for the new developments about the vaccines, and we shall be informing the population accordingly, depending on the progress we make based on the response we shall get from the Gavi financing facility.
All right, thank you so much for speaking to us, Emma, and we are very grateful for you coming all the way from Moyo to now. But thank you so much. We've been speaking to Emma Inebiona, who speaks for the Ministry of Health on the COVID-19 response, and we'll take a very short break. But when we return, we have our resident lawyer, Jacob, talking about the elections.